Welcome back to the channel. Last class we have dealt about the septic shock. We have dealt the clinical features about early warm shock, late cold shock, what are the organism causing septic shock, and then gram positive sepsis shock and gram negative sepsis shock. Now we'll be dealing with the treatment part of the septic shock and we'll ending septic shock today. Okay, let's start. Treatment. Firstly, we have to treat the infection. Then we have to treat the shock. Firstly, the treatment of infection by early surgical debridement and drainage by the use of an appropriate antibiotics. Drainage and debridement are two important steps in any infection. Infection by septic shock, sepsis, or any kind of infection due to alveolar infection, any infection, drainage and debridement is the first step you should do. We should always focus on removing the cause of infection or cause of the disease, then treating the other perspective of that. Okay, so first will be the treatment of infection by early surgical debridement and drainage by the use of proper or appropriate antibiotics. Then treatment of shock, which include fluid replacement, steroid administration and use of vasoactive drugs. Fluid replacement, as we have seen in later stages, it causes hypovolemia. Okay, steroid administration for anti-inflammatory causes and use of vasoactive drugs. Now, what are the antibiotics of choice for the septic shock? First is cephalothin, which is 6 to 8 gram per day IV in 4 to 6 divided dose. Second is gentamicin, 5 mg per kg per day, or clindamycin. Okay, these are the choice of antibiotics for septic shock. Now, what are the choice of steroids for septic shock? First is the methylprednisolone. Okay, initial dose of 15 to 30 mg per kg of methylprednisolone or equivalent dose of dexamethasone. Either give methylprednisolone or give dexamethasone. Dexamethasone is given IV in 5 to 10 minutes. Okay, either methylprednisolone or dexamethasone. Now coming to vasoactive drugs, mixed alpha and beta adrenergic drug. We give mixed alpha and beta adrenergic drug, that is metaraminol. Now vasodilator drug is also given, that is phenoxybenzomide, and inotropic agent like dopamine or isoproterenol. Okay, these are the choices of drugs in septic shock. But always remember, fluid replacement and surgical debridement and drainage is very important. Okay, that's about the treatment of septic shock. Now, in general, in distributed shock, the peripheries will be warm and capillary refill will be basic despite of profound shock. We have seen there will be abnormally increase in cardiac output. Okay, now traumatic shock is same as hypovolemic shock, but the difference is presence of peripheral and pulmonary edema. We have seen this, and infusion of large volume of fluid inadequate for traumatic shock. In a hypovolemic shock, the replacement of fluid is in the large volume, but in traumatic shock it is not in the large volume. Okay, this is the basic difference between the traumatic and hypovolemic shock. Now in general, or in case of traumatic shock, what are the treatment plan? This is resuscitation, then local treatment of trauma. I have always said that remove the cause first. Control of bleeding, very important. Fluid replacement and IV dose of 10,000 units of heparin. Okay, it's an anticoagulant. It helps in control of bleeding. So this is the treatment for traumatic shock. Okay, we'll be dealing the management of shock in general in detail in the next class or in the coming class. Till then, like, share, subscribe and comment. Bye.